Hi, I am Dr. Sandeep Devasys Misra, a senior consultant diabetologist from Cuttack, Odisha. Today we will be discussing about some basics of diabetes. Diabetes is a chronic disease that occurs when blood sugar or glucose is very high. Glucose is derived from the food we eat. In diabetes, pancreas is no longer able to make insulin, or the body cannot make good use of the insulin it produces. Insulin helps the glucose to pass from the bloodstream into the cells in the body to produce energy. All carbohydrate foods are broken down into glucose in the blood. Basically, there are three main types of diabetes, that is type 1, type 2 and gestational diabetes. Type 1 diabetes can develop at any age but occurs most frequently in the children and adolescents. When you have type 1 diabetes, your body produces very little or no insulin, which means that you need daily insulin injections to maintain the blood glucose levels under control. Then comes the type 2 diabetes, which is more common in adults and accounts for around 90% of all diabetes cases. When you have type 2 diabetes, your body doesn't make good use of the insulin that it produces. Several risk factors are associated with type 2 diabetes, namely the family history of diabetes, being overweight or obese, unhealthy diet, physical inactivity, increasing age, high blood pressure, etc. The cornerstone of type 2 diabetes treatment is healthy lifestyle, including increased physical activity and healthy diet. However, over time, most people with type 2 diabetes, they all require oral drugs and or insulin to keep their blood glucose levels under control. Then comes the gestational diabetes, which is a type of diabetes that consists of high blood glucose during pregnancy. It is associated with complications to both mother and the baby. It usually disappears after pregnancy, but women affected and their children, they are at increased risk of developing type 2 diabetes later in the life. Thank you.